applications of digital dentistry in clinical specialties. So there are so many different clinical specialties in dentistry where digital dentistry and those core technologies that we've looked at throughout last week can be applied. So what we will do is to take them one after the other. If not for the limited time that we have, what I tried to do for us is to put one case scenario for each application, so that we can, each one we discuss, we put a case scenario and see how in clinical operatives, how that will work, okay, how that will go from the workflow for each specialty in the application of digital dentistry or some particular digital tools in dentistry. But we can't fit that into this short conversation that we're having today, but we'll try to see how much we can do with this. So if we move forward from there, let's see what I have planned for today. So to introduce this session that we are going to do today, the few learning outcomes that we aim to achieve include that today we will use a little bit of time to look at, to recap on the advantages and disadvantages of digital of the core technologies in digital dentistry that we looked at, that we introduced on Saturday. Okay, we will look at them in more details. There are a few of them that we've not looked at, so we looked at those first and use that to recap what we did last week. And then I expect again that you will be able to understand and explain the different applications of digital dentistry in clinical practice. Okay, so we are still talking about the core technologies, but we will move on to looking at the applications in each specialty in dentistry. So the session today is broken into a few parts. So we are going to have a short recap session where we look at the previous topics that technologies that we have mentioned and the remaining ones that we've not really talked about, and then we look at introducing the concept of the applications of digital dentistry. We'll do some in-class activity where we will use one example, one case scenario to look at how a patient that is presenting with a particular complaint can be handled using digital tools. But what we will do is that we are going to have a practical session where we can actually cover multiple case scenarios for each of the dental specialties and see how digital dentistry can be applied in different specialties. We'll look at practical case scenarios and try to practicalize the things that we are learning. Okay, so let's have a quick recap on what we did on last week. So to recap on what we did last week, we said that digital dentistry thrives on a powerful ecosystem of interconnected technologies. So digital dentistry would not be digital dentistry if we are just using one technology in digital dentistry, but we use so many different technologies that are interconnected with each other. Okay, so it is the interconnectedness of those technologies that make digital dentistry possible. So digital dentistry thrive on the a powerful ecosystem of these technologies that are linked to each other. We also said that digital tools are transforming how dental professionals diagnose and treat conditions today compared to what it was 25 years ago, 30 years ago. And also digital technologies are transforming how we engage with our patients and how we manage our practices. So we are going to look at patient engagement using teledentistry and also talk about application of digital technology in public health, dental public health and teledentistry as well. We'll look at the application of digital technology in patient engagement and also in practice management. How do we manage our dental practices and all of that? We'll do some comparison between that and what it would have been or what it is for so many people who are still using, who have not gone digital. Okay, so if we step on to looking at teledentistry and visual consultation. Now, may I ask, is there any person here that can do a little bit of reflection on your experience of teledentistry or visual consulting? Have you been a part of teledentistry or visual consulting, or maybe visual consultation in any other aspect of healthcare? Anyone? Can you tell us your experience just briefly? Thank you. That's a very practical experience, and that's a very that's a very practical experience of. No, I have to put you on mute because of the echo is echoing back to me. Yes, so thank you for that contribution there. So one of the challenges that you have experienced doing visual consultation and teledentistry, depending on what part of the world you are, it will be network interruptions. That is really very, it makes things really difficult. And when people cannot get quality images for you, so if you are doing temporary, let's say you are doing triage, you want to do patient triage. Like myself, one of the things that I do through my organization is to do patient triage. So I have a clique of clinics that work with me, and when patients come digitally, I do a triage. So I have to look at I have to conduct a visual consultation for them, and then based on the problem that they are presenting, I can triage them to one of my partner clinics where they can actually be taken care of practically. Now, one of the challenges that I face as well is what you have just explained. Network interruption can be very difficult. It can make teledentistry or visual consultation to be very difficult, and again, poor quality of images produced from those interactions can also distort the picture that you're trying to use to make your assessment of that patient at that time. So that is one problem that you have identified. Thank you for that. So what we are saying is that teledentistry and visual consultations, they allow a dental practitioner to evaluate, diagnose, and monitor patients remotely using either video calls, chats, or digital records. Okay, so this could be a digital record from a previously taken X-ray or previously taken images and all of that, which is shared with this dental professional who will look at that without needing to be with the patient. If the image quality is really good, if the video qualities are good, the clinician can make an accurate diagnosis of the patient without needing to be there in person. But that does not mean that the clinical intervention will be done without the patient being there. There are some treatment that you must do. The treatment that you can do without the person being there would be in line with prescription. Okay, you would prescribe treatment that will be carried out by someone who is there, but again, it gives you that opportunity. So if you have a consultant who is far away from the clinic and there is a patient that needs to be seen, so you can reach the consultant using visual consultation and teledentistry. Now, if you have a patient who is remotely in the comfort of their homes or in a place where they are not able to travel to your location, you can also engage them via visual consultation and teledentistry. Now, there are different types of teledentistry that is available. Some tools that is out there. Synchronous is there. It gives you real-time video consultation. So these are systems that power teledentistry and visual consultation. We have synchronous and asynchronous one. So the synchronous one is the one that gives you the real-time video consultation of a patient. So a patient is there and you are here, and in real time you are having that conversation. Now, asynchronous one is store and forward, where you, for instance, you can have a patient gather images of whatever the situation is. They store it and then they forward it over to you, and then you can pull up their file, look at their file, make an assessment and get back to them. So you can see there are two different types there. Okay, so you have the synchronous one and the asynchronous one, which is the real-time one and the one that is stored and forwarded. Now you have the remote monitoring. This one tracks treatment progress using, for example, using something like Invisalign. So some of this, there's what we call my Invisalign app that can also be used to track the progress of the treatment. So if you have a patient that is that you are treating their malalignment or whatever problem it is with Invisalign, then you can use the app to actually monitor the progress of that treatment. You have mobile dentistry integration. This one is community and rural outreach based. So this is the one that there are mobile dental vans. Okay, is anyone here that have come across a mobile dental vans? Like in some of my outreach programs, if we have to go to a different location, and okay, let's take for instance, I'm working with people experiencing homelessness in the UK, and then when I go to them to speak to them about the oral health and access to care, and we try to design a care pathway for them, one of the challenges that we have is that most of them are unable to get to where we are. So the ideal thing would be for us to find a way to get to where they are. And we can do that using your domiciliary service or the community or rural outreach service. So there are some vans that are designed and tailored to do those services, where you have everything you need. It's more like an ambulance service where you would travel to the patient. I did quite a lot of that when I was still practicing in Nigeria. I had my own vehicle that I would use to travel to different locations to attend to patients at community and rural outreach level. So this is another way that you can actually practice dentistry and visual consulting. Okay, so what are the advantages of teledentistry and visual consulting? We have increase in access to care in remote areas. So there are so many people, like for those of us who live in very urban areas, we may not understand. If you live in an area where there are dental practices around you, you will not understand what we are talking about. You may not understand the need for this. But there are people that live in a place where the closest dental practice to them can take a whole day journey. Okay, so in such a case, if you engage teledentistry and visual consulting, you eliminate the need for so much travel for dental consultations, and this will in turn make people to access dental services without having to bother about the travel, at least at this stage where you are still doing consultation and diagnosis. It reduces unnecessary in-office visits. There are some visits that are really not necessary, to be honest. If you just have to come to the doctor or come to the dental practitioner from wherever you're traveling to, for them to just look at your mouth and write you some prescriptions, write you some pain prescription, that journey is really not necessary. So if you can communicate with them and have visual consultation where they can actually give you those prescriptions without you having to travel, that is one advantage of teledentistry. Teledentistry and visual consultation make those possible for us to enjoy. It enhances patient convenience and compliance, and also supports continuation or continuity of care. Okay, so it supports continuity of care. It makes sure that even when the patient has been discharged, assuming you had a face-to-face patient who came for oral surgery or whatever kind of clinical intervention, and when they leave, you can actually follow up on their care to make sure that maybe they are complying with the instructions that they've been given, all the things that they've been taught in the clinic, all the oral health instruction and oral hygiene instruction, that they are still complying with it. You can do that without having to ask them to come to the clinic every day to answer some questions about their compliance, and also for you to support them through their care. So that is another big advantage of teledentistry and visual consulting. But as with every other thing, there are some limitations with teledentistry and visual consulting, which is one of the things that we have explored based on our own experience of, like you said, we talked about poor network, poor image qualities, and all of that. Now, there is limited, as well as those that we have said based on our personal experiences, there is limited physical access to people. No matter what we do, it is important that we still make our physical contact with our caregivers and our dental professionals. So the complete reliance on teledentistry and visual consulting limits those physical assessments, and you cannot replace that completely like that, especially when it comes to dentistry. And then licensing and reimbursement variability. So when it comes to reimbursement, how do you really actually get paid for the teledentistry and visual consulting, and how are people licensed to do that? Do we have the need to license people specifically to practice those? Do we have the need to calibrate the people that are doing those? Do we rely on the diagnostic accuracies of the people that are doing those consultations on visually? Do you understand what I'm trying to say? So do we have enough faith in them to say that their diagnosis of my condition, if I am a patient, do I have enough faith in this clinician to say that his or her diagnosis of my condition will not change even if I was there in person? Okay, and again, there is this question around data privacy and concerns. Okay, when things are being transmitted via the internet and all of those networks, then it brings the question of data privacy. Okay, it brings questions to data privacy. Do we maintain privacy for the data of our patients? So that is one aspect that we have not looked at, teledentistry and visual consultation. Now, the other aspect